Welcome, guys, to another episode of a learning episode, right? Yes, this episode I'm going to do something on hemorrhoids, right? So many people have asked me questions about hemorrhoids, right? So today let's talk about hemorrhoids. Let's learn what is it, what causes hemorrhoids, what are the signs of hemorrhoids, how can you know that you have hemorrhoids, how do you manage it, right? Yes. So basically in this episode we're going to talk about hemorrhoids, right? Yes. If you have not subscribed, just take a minute to subscribe, right? And please like the video, continue sharing and continue commenting, right? Yes. Let's continue interacting in the comment section. Yes. Having said that, let's begin. What's hemorrhoid basically? So hemorrhoids are just swollen veins around the lower part of the rectum or around your anal areas, right? Yes. So these are just swollen veins. They are veins that are just filled with blood, right? So, what causes these swollen veins around the anal area, around the lower part of the rectum? So, we have very many causes of hemorrhoids, right? Yes. So, the first cause is straining, especially during bowel movements, right? So, you are on low fiber diet, you are not taking a lot of fiber, right? So you get to strain during bowel movements. So straining during bowel movements can exert a lot of pressure on the veins around the anus, on the veins around the rectal area, right? And this can predispose you to hemorrhoids, which are the swollen veins around these parts, around the anal area, around the rectum. So the first cause is straining during bowel movements. Apart from that, you have low fiber diet, right? You are not taking a lot of foods, you are not taking a lot of vegetables, right? You need to consider your diet. Because low fiber diet can lead to constipation. And if you have constipation, you are going to strain a lot during bowel movements, right? If you strain a lot during bowel movements, you are likely to exert a lot of pressure on the veins around the anal area, on the veins around the rectum, and this can predispose you to hemorrhoids, right? They are very painful, right? Yes. So low fiber diet, straining during the bowel movements. Another cause is sitting for prolonged durations, right? This happens a lot nowadays. Just you go to get yourself in the toilet, you are browsing, you are on the internet, you are using Wi-Fi, right? You are sitting on the toilet even after finishing your day break there, right? You are sitting for maybe 30 minutes, for some sit even for 1 hour, right? So sitting for a long period of time, especially during bowel movements, right, can predispose you to hemorrhoids, right? Just go there, finish your business, and run back to where you're going, right? You don't need to go to sit there for 1 hour, sit there for 2 hours. You are exerting a lot of pressure on the veins around the anal area. You are exerting a lot of pressure on the veins around the rectum, and this can predispose you to hemorrhoids, right? Yes. So consider that, right? It predisposes you to the hemorrhoids, right? So apart from sitting for prolonged duration of time, we have chronic diarrhea. You are having diarrhea, right? Every now and then, right? Every now and then you are running to the toilet, every now and then. So this continuous bowel movements can exert pressure, right? Can exert pressure on your veins, right? And this can predispose you to hemorrhoids. So apart from chronic diarrhea, apart from low fiber diet, apart from what we have mentioned about prolonged sitting duration, especially in the toilet, we have obesity and pregnancy. So obesity and pregnancy, they go hand in hand. In pregnancy, you have a gravid uterus, right? So the gravid uterus exerts a lot of pressure on your pelvic structures, right? So this pressure exerted by the growing embryo, the growing fetus, exert a lot of pressure on your anal veins, right? This predisposes you to hemorrhoids, right? So there are people who suffer hemorrhoids especially post-delivery. There are people who suffer hemorrhoids, right? Yes. And also I've said about obesity, right? You have a lot of weight, right? So you have a lot of fats in your pelvic area. These fats exert a lot of pressure on your veins, right? Especially the veins around the anal area, the veins around the lower rectum. And this can predispose you to predispose you to what we call hemorrhoids. Another main cause of hemorrhoids is what we call anal intercourse, right? So we have our friends who they are on that other side of the pyramid, right? So they are having anal intercourse. So anal intercourse, especially exert direct pressure on these veins, on the veins of the anus, on the veins of the lower rectum. This can lead to accumulation of blood in these veins, right? So if this we have accumulation of blood in these veins, they get swollen, right? It can predispose you to hemorrhoids, right? So anal intercourse is one of the predisposing factors, is one of the causes of hemorrhoids, right? Yes. So apart from that, you have heavy lifting, heavy weight lifting, right? So if you have you are lifting heavy weights maybe for a long duration of time, you are every now and then you are tightening the muscles of your pelvis, right? Which is also a good thing. But prolonged duration, let's say, with lifting, right? You are exerting a lot of pressure on these veins, right? Continuous heavyweight with lifting can lead to accumulation of blood in this vein, right? And this can predispose you to hemorrhoids, right? Yes. Having mentioned these causes, we have the signs. How do you know that maybe you are having hemorrhoids? We have some signs that can show you that you are having hemorrhoids, right? So one of the signs is irritation, right? You have chronic irritation or itching. You have an itchy feeling around the anus, right? You have itchy or irritation around the anus. This can be very disturbing. Just imagine a situation where you are in a meeting, right? You are maybe at a certain event, and you are having a chronic irritation. You are having a chronic sensation of itching around the anal area, right? You are not comfortable. Maybe you are the one who is chairing the meeting, right? And this is the time that you are having this kind of serious itching, right? So it can be quite uncomfortable. So that's one of the signs of hemorrhoids. Apart from that, you have pain around the anal area, right? So it presents with a lot of pain, right? So because of the swollen veins, it presents with a lot of pain. So this is another sign that can tell you that you are having pain. Can be another important sign that can tell you that you are having hemorrhoids, right? Pain around the anal area. Apart from that, you can have what we call the fistulas, what we call the fecal incontinence. We just seated somewhere, right? You just have your stool passing around, right? Stool is leaking, right? So fecal incontinence can be a very, very big sign of hemorrhoids, right? Yes. So those are some of the common signs of hemorrhoids. So they can tell you that you're having hemorrhoids. You have itching around the anal area. You have pain around the anal area. You have maybe fecal incontinence. So this can tell you that you're having hemorrhoids. You need to consult a physician. You need to consult as early as possible, right? Yes. So you have different types of hemorrhoids. You have different types of hemorrhoids. You have two main types of hemorrhoids. We have the internal hemorrhoids and the external hemorrhoids. So the internal hemorrhoids, they are hemorrhoids that occur around inside the rectum, right? The veins around the rectum. So this one does not present with much pain because there are little pains sensory nerves around the rectum. So they don't present a lot of pain. They can be painful, but they are not that much painful, right? Because there are no more since pain sensing nerves around the rectum. We have the external hemorrhoids. These are visible hemorrhoids around the anus. You can see visible lumps around the anus. So these are what we call the external hemorrhoids. So these are very, very painful. They are very, very painful. Why? Because there are a lot of pain sensory nerves, right, around the anus. So they are very, very painful, right, compared to the internal hemorrhoids. Yes. Having mentioned that, we talked about the signs. We talked about pain. around the anal area. We talk about you can see visible lumps around the anal area. You can have fecal incontinence, right? You can have chronic irritation of chronic itching around the anal area, which you have said it can be very, very uncomfortable. So how do you manage? How can you prevent hemorrhoids? How can you manage hemorrhoids? So one way you need to be well hydrated. Drink a lot of water, right? Maybe 6 to 8 glasses, or if you can, maybe 10 glasses if you can, right? So drink a lot of water, stay hydrated. It can help you solve straining maybe during bowel movements, right? And this can help you to relieve pressure from the anal veins, right? So stay hydrated. High fiber diet. Eat a lot of fruits. Eat a lot of vegetables, right? Yes. So they are rich in fiber. They will help you to avoid constipation, because constipation is one of the main contributing factors to hemorrhoids, right? So a high fiber diet, right? I've mentioned about stay hydrated. Again, don't sit for too long, right? Especially during bowel movements. So you just get yourself in the toilet. Don't sit there too much, right? For a long period of time. Just go there and do the business that taken you there, and get yourself out of that place, right? Sitting for too long, especially during bowel movements, we've said that it can exert a lot of pressure on your veins, especially the veins around the anal area, and it can predispose you to hemorrhoids, right? Yes. Apart from that, exercise, right? Exercise. You need to do some exercises. Don't just sit. Don't just walk around, because you said obesity is one of the risk factors, one of the contributing factors to hemorrhoids, right? So manage your weight and do a lot of exercises, but again, don't overdo the exercises, because again, you've said heavy weightlifting for a long period of time can also predispose you to hemorrhoids, right? Yes. So those are the kind of some kind of management. We have also some kind of medication that can help you. You need to consult your physician, right? We have kind of medication that can help you. Surgery can also be done that can help you correct the hemorrhoids, right? So again, you need to consult your physician, right? But there are kind of lifestyle that if you live, it reduces the chances of having hemorrhoids, right? Yes. So having mentioned that, we have complications. We have complications of hemorrhoids. Hemorrhoids can predispose you to one or two things, right? One is anemia. For example, if you're having chronic bleeding, just say that one of the main signs of hemorrhoid is bleeding, right? So you can have blood in stool. So if you have chronic bleeding, you are likely to have anemia, right? So anemia is one of the complications of hemorrhoids. Apart from anemia, you can have anal prolapse, right? The anal, due to the swollen veins, around the anus, around the lower rectum, you can have what you call anal prolapse. Apart from that, you can have what you call fecal incontinence, right? Like all of the fistula, right? You can have abnormal connection between the rectum and the anus, right? Because of the hemorrhoids. So hemorrhoids can predispose you to anemia, it can predispose you to anal prolapse, and it can predispose you to fecal incontinence or fecal incontinence or the fistulas, right? Yes. So you need to be very careful with the lifestyle you lead, right? Yes, because it can play a very, very big role as far as hemorrhoids is concerned. So that makes the end of marks the end of our video for today. I hope you learned something. Continue subscribing, continue liking, and continue commenting, right? See you in the next video.